It's been 6 years since Ohio voters were asked to make marijuana legal in the Buckeye State. They said no. But since then, medical marijuana has been legalized in Ohio. And while that is expanding, cannabis supporters aren't stopping there. There are now 2 bills and a ballot initiative in Ohio that would allow adults to smoke them if they got them. It started with that ballot initiative by the Coalition to Regulate Marijuana Like Alcohol, which, once they have enough signatures, sends that measure to state lawmakers. If they don't do anything after 4 months, they'll collect more signatures to take it directly to Ohio voters next year. With all of that, it's no surprise that experts say we could have legal pot in Ohio in the next few years. Not everybody's so excited. In this News 5 original, Kevin Barry explains why.
All around Corrine Gasper's home are memories of her daughter Jennifer, who would have turned 32 this past October.
We need to educate parents, and we need to educate children and our lawmakers to let them know exactly what this is all about.
Because Jennifer died in 2012 when her car was hit by an impaired driver near Cleveland, ending her life.
And this man was from the state of Michigan. He was passing through our state, and he was high on the medical marijuana that he had gotten from his state, Michigan.
That's why Corrine's organization, Jennifer's Messengers, teaches people about the dangers of drugged driving and opposes legalized marijuana. She points to data from states like Colorado, suggesting that traffic deaths have increased significantly since pot was legalized there.
You know, my concern with full legalization of marijuana is that we're losing those bumpers that keep us safe.
Fran Gerbig at the Prevention Action Alliance says Ohio's medical marijuana program at least has patients get permission from doctors before they can buy any marijuana and makes them come back for a renewal every year. Legalization would cut those steps out.
And if we take away the bumpers, those protective factors around marijuana and make it completely legal, who's going to be monitoring that? Who's going to be helping you make good decisions?
Lawmakers say they're taking some of those concerns into account. Republican Representative Jamie Callender is working on a bill right now that would legalize marijuana in Ohio for anyone 21 or older, while learning from the mistakes that he says other states have already made.
We're really taking the medical program and expanding it.
He's satisfied with how Ohio's medical program has run so far. State testing makes sure everyone knows what they're using, and dispensaries are very secure.
A 17, 18-year-old can't just walk in off the street and buy it. That's not going to happen.
Everyone seems to agree it's a matter of when, not if, marijuana will be legal in Ohio, including Gary Wolski at Ohio's Fraternal Order of Police.
I mean, we're still going to have a problem because it still creates a problem, whether it's legal or illegal. You know, if the legislature decides to make it legal, people are still going to be out there driving under the influence, which creates a problem for everybody.
That's why he says the next focus needs to be on education similar to what already exists for drunk driving, teaching people about the law, signs of impairment, and how to keep everybody safe to prevent more crashes like Jennifer's.
She was just everything I could have wanted, doing nothing wrong. And she was wiped off the face of this earth because somebody was irresponsible enough to get in their car high.
In Cleveland, I'm Kevin Barry, News 5.
Meanwhile, state senators are looking to expand who is eligible for Ohio's medical marijuana program. Right now, there's a list of specific conditions that qualify, and while the Ohio State Medical Board can and has added to that list, a new bill would let a doctor prescribe marijuana as treatment for any kind of medical condition. The bill would also allow medical marijuana to be processed and dispensed in additional forms. It also opens the doors for more cultivators and dispensaries based on patient need and demand. And the need is there. More than 15% of medical marijuana patients in Ohio said they had to travel 30 miles or more just to get to a dispensary. So the Ohio Board of Pharmacy decided earlier this year to allow the number of dispensaries across the state to double. People could start applying for one of those 73 new licenses this month. If you'd like more information about any of the legalization of marijuana in Ohio or the various organizations trying to stop those efforts, you can find links to all of them in Kevin's story on our News 5 app.